releasing the results of the survey conducted by the Human Science Research Council on the impact and awareness of the coronavirus among South Africans, the virus which we all know that is sweeping across the world, including in our country. The survey comes amidst the unprecedented spread of the virus across the world, which necessitated that South Africa implements the lockdown from the 27th of March to the 30th of April to impede the spread of the virus and the rate of its infection. Minister Nzimande will be giving us the opening remarks to this media briefing, and the minister is joined by the Deputy Minister of Health, Dr. Pasha, and he is also joined by the Director General of the Department of Science and Innovation, Dr. Mjwaha. We are also joined by our colleagues from the Human Science Research Council that will be responding to some of the questions that will be asked by you members of the media today. They are in Cape Town. Unfortunately, we won't see them, but we'll hear them. However, at home, we'll have an opportunity to see the presentation of the survey that they have done. My name is Ishmael Nisi, and I will be program directing this briefing today. Members of the media, we have shared in our advisory the call number, which is 0800-142-446, and also our WhatsApp number, which is SA COVID-19 Media Update, where you can be able to send your questions there so that the panelists can be able to respond to you. As a norm, you will please introduce yourself and the organization that you represent and give us a brief question from yourselves. And for those that have sent questions, let me pre-warn you that some of the questions will be answered by the researchers themselves, and will share their details so that you can be able to forward those questions to them as they are not part of this briefing. Without any further ado, I would like to call upon the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, to address us. Thank you.
Thank you very much, Ishmael. As our program director, our Deputy Minister of Health, Dr. Joe Pasha, our Director General of the Department of Science and Innovation, Dr. Phil Mjwaha. Thank you very much for this opportunity. Good afternoon. Before we call upon the presentation to be made, we felt it is important to give this background information. Of course, everyone knows that communities are at the heart of any disease outbreak and health emergency response. With the deep inequalities and poverty that we face as a nation, flattening the curve through social distancing and enhanced practices will only be successful if we understand key social and behavioral factors that make this difficult. The work that will be presented here today is based on social science research and analysis, and it's led by our Human Sciences Research Council, which is one of the entities that reports to my Department of Science and Innovation. And I would like upfront to thank all the partners who were part of this research, as well as the participants themselves. The team will explain, once they take over, how they did this research, but what I want to say is that The research represents a survey that was undertaken between the 7th of April and the 14th of April and looked specifically at the lockdown as implemented by the President from the 27th of March. But before we can present the outcome of our research, we think that it is important to understand this research as part of a whole lot of other interventions that are being made by the Department of Science and Innovation as part of the fight against COVID-19. As soon as the gravity of COVID-19 came to light, the Department of Science and Innovation sprang into action, engaging its entities, including the HSRC itself, which will be presenting today, to determine how they could respond and how to coordinate the contribution of the National System of Innovation in dealing with this. Our National System of Innovation identified the following potential research and innovation projects or activities on which to focus: diagnostic tests, targeted surveillance of the virus, therapeutic trials for treatment, vaccine development, data and evidence, including involvement in the production of ventilators. Programs that are contributing to what we are doing through our National System of Innovation include the Strategic Health Innovation Partnership, the South African Center for Epidemiological Modeling and Analysis, the Center for the AIDS Program of Research in South Africa, which Professor Slim Karims is working with, the Center of Excellence for Biomedical Tuberculosis Research, and our technology stations programs. And our entities that are involved is the Center for Scientific and Industrial Research, the Technology Innovation Agency, the Human Sciences Research Council, as I have said, the South African Medical Research Council under the Department of Health, our South African National Space Agency, and the National Research Foundation. Very briefly, some of the work that we are involved in our fight against COVID-19. Much as there are no COVID-19 vaccine trials that are being undertaken in South Africa, two of the vaccines being investigated are based on plant expression systems that we have a connection with. The Center for Scientific and Industrial Research and the University of Cape Town are using these technologies and have proven their ability to locally produce vaccines in plant-based expression systems. South Africa is also participating in an international study of treatments for COVID-19 in hospitalized patients who are receiving drugs believed to have an effect on the respiratory disease. The Solidarity trial that is coordinated by the World Health Organization, whose main objective is to provide reliable estimates of the effects of some of these treatments. As South Africa, we are cooperating with this. We also would like to point out that, nevertheless, until there is sufficient evidence, the World Health Organization has cautioned against doctors and medical associations who may be recommending or administering some of these treatments that are still under investigation to patients with COVID-19. We are, as the Department of Science and Innovation, together with the South African Medical Research Council, in discussions with Medicines for Malaria Venture to explore the effectiveness of other anti-malaria and TB drugs against COVID-19. To put this simply, we are part of tests and experiments that are testing drugs that are treating other diseases on whether they are actually responding in treating coronavirus. As South Africa, we are part of that through our Department of Science and Innovation. We have also created a platform which we call the Dashboard, at which we hosted our President and Deputy Minister Pasha was there as well at the Center for Scientific and Industrial Research, a dashboard that collates all the statistics on COVID-19 throughout South Africa. As we speak now, we know exactly which cities have got how much people who have actually contracted the virus, how many people have been treated and recovered throughout the country, including in every locality. And that is being done as part of our work in the department to deal with the problem. We are also working with the Department of Public Works and Infrastructure to deploy products of our own research, fuel cells, which we're already rolling out, which are earmarked to provide energy in areas that do not have the required energy. Our department is also part of a number of other international initiatives. We, however, do need to emphasize this, that as yet there is no treatment and that there is no vaccine against COVID-19. That is why this social science research we'll be presenting now is trying to understand how people are reacting to the virus, how people are reacting to the lockdown and other measures that are taken to the government, so that we understand better what our people feel and how they think, so that we are better able to work together to confront this virus. With those words and background on the work that is being done by the Department of Science and Innovation, of which the HSRC is one of our entities, let me then allow the presentation by our researchers led by Professor Crane Sodin to share with you the results of the research that we have done. Thank you very much.
Thank you very much. Good afternoon, Minister. It's a great honor for us to be presenting to you and the South African public here the results of our lockdown survey. You know, Minister, we've been conducting this work over the last few weeks. And the work is essentially an attempt to make sense of what the South African public is thinking and saying about the situation in which we find ourselves. I'd like to say that there are some very important messages which come out of these results of the survey. An important message which you yourself have alluded to, Minister, is this difference in this survey in the results between what people know, and we think people know a great deal about the disease, the virus. But unfortunately, their risk perceptions are very problematic. South Africans have a low risk perception of what is coming. And this, I think, Minister, is an important finding which this particular survey helps us come to an understanding about. So I'm very happy to be giving the floor over now to Professor Priscilla Reddy, whom I'd like to thank for having led this particular study. Thank you very much, Minister.
Good afternoon, Minister. Good afternoon, fellow South Africans. Thank you for creating an opportunity for the HSRC to present the results of our work. Today we're going to talk about the survey that's looking at engaging communities with regard to their knowledge, their beliefs, and their practices and attitudes regarding the COVID-19 outbreak in South Africa. We acknowledge and appreciate the excellent work that has been done with respect to the epidemiology and healthcare aspects of disease. We also appreciate the extensive work that has been undertaken on the economic impact of this pandemic. This survey provides a starting point to balance the country's response at this tipping point in the fight against the pandemic, the socio-behavioral insights of South Africans. In order to do this, the HSRC has come up with an action guideline or a framework of health promotion and well-being so that we can strategize our interventions in a careful, planned, and systematic manner. We have what we call health promotion strategies, which involve health behavior and health behavior change, provision of health information, and health literacy. Additionally, we look at personal protective equipment and facilities, containment facilities. We also look at the legislation and policy, which is what the lockdown was about, and economic interventions, and needless to say, the biotechnological interventions, which comprise pharmaceuticals, vaccines, and as you know, the very important test kits. We also target our interventions at very specific levels, namely primary prevention or community level, well before a person gets the infection, to early detection and secondary level. This could either be at a community level or at an institutional level, and patient care level, which is the unfortunate case where we might find people with COVID pneumonia in hospitals. I am quickly going to summarize the extensive study design and study population. The HSRC's research response to COVID-19 outbreak employed a mixed methodology, and this is very essential in the case of an outbreak or a disaster, a rapid response, complementary studies. So we had quantitative studies in the general population, which was the initial socio-behavioral survey. The second survey is the lockdown survey, which I'm reporting on only today. Healthcare workers survey, which is currently underway, and I've put in the link, so I would like to encourage healthcare workers, frontline workers, not only doctors and nurses, all healthcare workers to go in and fill in this survey. We would like to hear your views. Then we've got the youth survey. Our data has been benchmarked using the general population demographics from Stats South Africa, showing the mid-year estimates so that our findings can be generalizable. We have a whole batch or battery of qualitative studies targeting special populations. And again, our sample is South Africans 18 years and older. And the qualitative work is actually targeting going in depth, and this is the work that helps us explain some of our quantitative findings as well. In addition to this, we have got a continuous social media study going on, and we can provide data from that study on a day-to-day basis, digging down deep into whatever area in the country that we would like to get information on. We have very serious partnerships with UKZN, SAPRIN, the SAPRIN Network, Walter Sisulu University, NIHSS, Acumen Media, and other people as well. In this slide, I'm purely trying to show how data is benchmarked to the distribution of the South African adult population using the mid-year population estimates, specifically by age, sex, race, and province. This allows generalizability of the data. So today, we have the pleasure of discussing our preliminary results from the lockdown survey. The data has been captured between the 8th and the 24th of April. So what are we looking at here? We're looking at moving from a lockdown to community participation, community motivation, and enablement. So the first slide is indicating the demographic profile by race, sex, and age, and here we see that 70% of the 19,330 participants were between the ages of 25 and 59. We've broken down the age groups in this manner because this shows us who's susceptible to infection and who's not, and how the infection plays out in the different age groups. We also see that we have slightly more females than males in the survey, with females representing 52%. This is a demographic profile by employment. Importantly, in this slide, we see that 36% of the participants are unemployed, 10% had informal or part-time work, and 9% were self-employed. The profile by province, we see that the majority of the participants come from Gauteng, 28%, KwaZulu-Natal, 18.3%, and the Western Cape, 12.4%, with the Northern Cape being 2.1%. In terms of community type, we see that 35.1% were reported as township dwellers, and 20% reported themselves as rural dwellers. The slide on knowledge about COVID is very interesting, and we've measured knowledge using several items. So we see that the knowledge between staying 2 meters away from another person, wearing a mask correctly, staying away from people who are infected, not touching your nose, face, or eyes, and washing your hands frequently for 20 seconds varies between 97% and 85%. So this knowledge is very high, which is suggestive that all the health education interventions that we've seen on the television by the President, by the Minister of Health, and other important people has made some dent in knowledge. So we are here with a very high knowledge situation. However, in the next slide, we examine risk perception. And what we see is that the majority of people perceive themselves as low risk, with the second amount perceiving themselves at moderate risk. So we're looking at 46% and 32% respectively there. So what are these two data sets telling us? What does the findings actually tell us? What it's saying is that being in a situation of lockdown could have given the 1 in 2 people a sense of security, so they perceive themselves at low risk. 1 in 5 people believe that they are at high risk for infection. So how do we move this data to action? If the burden of disease is high and generalized, the mortality is high. Most people will perceive themselves to be at high risk. But when the curve is flattened and the burden of disease appears to be relatively low and the mortality low, then most people will perceive themselves to be at low risk. This complacency could be due to the success of the lockdown. We may become victims of the successes gained during the lockdown if preventive behaviors are not intensified as we move forward into this epidemic. So what is the health promotion strategy here? The strategy is both behavior change and one of policy. As we lift the lockdown, preventive behavior change has to be intensified. All people of South Africa need to take responsibility for their own behavior. Targeted messages have to promote voluntary behavior actions such as hand washing, social distancing, and the wearing of masks. The tipping point between the economic, epidemiologic, and social and individual behavior is on the line here. The next slide demonstrates staying at home by age and community type during the lockdown. What we see here is 30% reported that they had not left their home since the start of the lockdown, and 62% indicated that they'd left their home to get food and medicine during the lockdown. What are these findings telling us? The majority of people adhered to the lockdown. The results show that 99% either left their homes for food, medicine, or social grants, and the rest of them stayed at home. This is compliance. From data to action. This is important to build upon. The country needs to move from a situation of lockdown to appealing to the community for participation and invoking a spirit of Ubuntu. What is the strategy here? The message is for South Africa, you can do this to save lives. Take control of your lives to prevent you, your family, and your neighbors from contracting this lethal virus. Adherence to the lockdown regulations. What we see in this slide is a question about what did people do or how many people they came into contact with when they were out of the homes, when they had left their homes. We see that only 20% indicated that they had left their home, and 8% indicated that they met more than 50 people. But there's a continuum here as well. What are the findings telling us? It is saying that 29% of the people reported that they came into close contact with 10 or more people during the past 7 days when they were out of their homes. Another 15% indicated in another question that they had used public transport to go to the shops. These are all high-risk situations. How do we move from data to action? It is important to use psychosocial and behavioral determinants to build targeted, culturally appropriate behavior change approach regarding social distancing and its meaning in the local context. We've asked people to deconstruct their normal lives to break the chain of transmission. The strategy here, or the health promotion strategies, involve a combination of strategies from behavior change, policy-level interventions, and economic interventions. The message is that South Africans have to disrupt their social relations and activities in order to save lives by adopting social distancing. Anyone can be infectious with or without symptoms, so everyone needs to have a duty to protect others by wearing masks whenever they are out of their homes. The message is for public transport to disinfect the taxis, for example, and to ensure the use of masks and social distancing both inside and outside of the taxis. Our messages need to be enabling. What is it you can do to prevent the spread, rather than what you can't do and what you shouldn't do. The next set of slides are about access to essentials during the lockdown. What we see in this slide is that just under a quarter, about 24% of the participants had no money to buy food. More than half, 55% of informal settlement residents had no money for food. About 2/3 of the participants were from townships, and they had no money to buy food. A very important one here is access to chronic medication. What the data is saying is that approximately 13.2% of the population indicated that their chronic medication was inaccessible during the lockdown. About 13 to 25% of those in informal settlements and rural areas and farms indicated that the chronic medication was not easily accessible. So, how do we move from data to action? Impoverished and remote communities continue to face barriers to our healthcare access. This determines their healthcare seeking behavior. These people who are struggling to access chronic medication during the lockdown will probably be the same people who struggle to access healthcare services related to COVID-19. It is therefore important to relook at primary health care at the municipal level and to re-examine the role of community health workers and family caregivers and the youth. The strategy is one of behavior change as well as a policy-level intervention. We need to build a social compact to create a new model between the healthcare system and the local community at municipal level. The message is, take the medicines to the home. Perhaps we could learn from the Cuban experience here. We also tried to look at some determinants of behavior. And for the purposes of this presentation, we're looking particularly at financial capability, where we measured financial capability with several items. I feel that the coronavirus lockdown will make it difficult for me to pay my bills, will make it difficult for me to earn an income, would make it difficult for me to feed my family, and difficult to keep my job. We see that the percentage for these items vary from 45 to 62%, a large percent who can't pay their bills and are worried about losing their jobs. So what is the data from Action saying here? Structure the packages and expand the reach of the government's economic and social relief programs in a way that every person feels that they are being taken care of, and in a way that ensures accountability at all levels with immediate consequences for violations. The health promotion strategy here is multiple. It's a behavior change one, it's an economic one, and a health policy one. The message is that the government and society as a whole acknowledges that some communities are struggling and that people have no money to buy food. This acknowledgement will continue to buy goodwill. Create a social compact with communities and the public and the private sector to ensure sustainable financial and social relief. This should include promoting intergenerational cohesion, sustainability of food vouchers or food banks at the level of the district. The next slide looks at adherence to regulations in terms of accessing cigarettes and alcohol. Cigarettes were more accessible than alcohol down. A quarter of people in informal settlements were able to buy. What are the findings telling us? Cigarettes, that is 12%, were more accessible than alcohol, that is 3% during the lockdown. So how do we move from data to action? 1 in 5 people in South Africa currently smoke, and approximately 1 in 10 smokers were able to access cigarettes during the lockdown. The continued access of cigarettes in the informal settlements could imply informal trade. The health promotion strategies here involve a combination of behavior change, information, and policy-level intervention. This highlights the need for tobacco control interventions to prevent illicit trade and smuggling. The results also show a call for a better regulation of tobacco sales in the informal settlements. And perhaps here again, it's a call for community participation and voluntary behavior change. The experience with law enforcement. We found that 74.8% indicated that they had no involvement with law enforcement. 14% felt that they had been treated in a rude or rough manner. 7% felt that they were treated fairly well, and 3.5% felt that they were treated in a respectful manner. So the findings are telling us that the majority of people were not involved with law enforcement, and 15% were treated roughly. How do we move from data to action? The speedy introduction of regulations without guidance and support sets people up for failure. But we had no option with COVID. We had to act quickly as a nation. There's a need to be sensitive to the major disruptions in people's lives. In order to ensure that the law is enforced, they play multiple roles. This is the law enforcement officers. They play multiple roles, from education and information provision to enforcement and social support. The health promotion strategy here is one of promoting behavior change and a policy-level intervention. We have to provide clear guidance and support to people so that they are able to adhere to the regulations. Acknowledge that it's difficult for people to make these major changes willingly to protect their families and communities. Law enforcement should be provided with clear guidelines and support to enable them to deal with intentional violators and the risk takers in society. Some closing remarks. We are at a moment of psychological crisis. The situation is immediate. We, however, do have empirical data that demonstrates goodwill, solidarity, altruism, and Ubuntu. South Africans are saying, we have your back. However, we need to act quickly because in the medium term, challenges will open us to scrutiny and debate. The difficulty in accessing food, medicines could erode the goodwill. The survey has shown that we have a window of immediate opportunity. I would in particular like to thank all the South Africans who made the effort and took the time to respond to the survey. Some of you responded directly online, and others of you responded to telephone calls from our volunteers, medical students, and research assistants. Thank you for sharing your views with us, enabling us to take your views into policy and decision making. Thank you, South Africa.
Thank you very much. Good afternoon, Minister. It's a great honor for us to be presenting to you in the South African public here the results of our lockdown survey.
Thank you very much, and thank you, team HSRC, for the presentation. Ministers, the DG, it is about, we are entering into the second phase actually of our media briefing to take clarity-seeking questions from members of the media. Colleagues, you have sent your messages or your questions on our WhatsApp group. The panel will answer those, and others have also will be calling in, and the team here will read the questions for us. And on WhatsApp, Takalani would read the questions and will also take questions from, or telephone questions. And also Priscilla, hoping that you are ready that side. Priscilla from Cape Town will be able to respond to some of the technical questions that you'll be posing as members of the media. Thank you very much. May I take this opportunity and get the questions, team? The WhatsApp questions, Takalan?
No, thanks, Ishmael. On the WhatsApp, the first question that we have is coming from Geoff Hill from the Washington Times, who said, can we have an ethnic breakdown on cases and death? And the second question is from Charlotte from EWN. He said a few weeks ago, the minister made reference to a plan to repurpose laboratories to manufacture test reagents here in SA. He said, please, could he give us an update on how far is the process, and are we manufacturing yet? If so, on what scale? If not, when do we expect to see that happen?
Thank you very much, Takalani. Is that
yeah, those are the questions that we have for now.
Thank you very much. Ministers?
These questions maybe...
Minister? You kindly come.
Oh, okay.
Because of the camera. Thank you.
These questions, unfortunately, are not really related to the survey that we had done, except perhaps, although we're willing to answer them, except perhaps I can ask my DG just to talk a little bit about the repurposing. But also the others, the Deputy Minister, I think, can be able to answer them. Maybe we can start with you, Deputy Minister, on the issue of are we doing any ethnic breakdowns in terms of deaths and all that, and maybe the issue of manufacturing, you know, maybe the DG as well may cover that. But Diane, you want to come?
Well, in response to the question on death breakdown by race or ethnicity, I'm aware that this question did come up sometime during the week, if not yesterday. I happen to be following the press briefings here, and I know our colleague Minister Mthembu dealt with it, but I'll just reiterate what he said, which is that the disease we're dealing with here doesn't know any race or class, rural, urban. It affects everybody. So as a South African government, we deal with it with that approach. So we look at the burden of infection in terms of areas where it's dominant currently, and what interventions to make. We look at various other demographic, analysis in terms of mortality, what is the kind of portion of society which is mostly affected, which is a portion of society which is succumbing mostly to the disease, so that that information which guides our intervention, our movement of people, resources, where should we put additional hospital beds, where should we put additional screening and testing, that's really what guides us, because that's why when you look at our results analysis, it will never go into issues of race and ethnicity, because we only look at data which helps us to manage the pandemic. And at this stage, there is no, I know that there have been fake news in the past which had suggested that the disease does not affect people of a particular race or ethnicity. But I think we're far away from that by now. Over the last 2 months or so, that false fake news has been proven to be a fallacy. And therefore, we're not even worried about that, and we would want to again just emphasize to all South Africans that this disease, if you ever had any false information that the disease is for some people and not for you and whichever ethnic or race or religious group you may be coming from, we have bad news for you, because that doesn't work. This virus does not know those things. In terms of the things which it says predisposed to that, if you don't social distance, if you don't practice hand washing and all the precautions, it doesn't matter who you are, whether you come from urban, rural, or whatever ethnic group, the disease will be a threat to you. Thank you very much.
Okay, let me go back to the questions of the manufacturing, local manufacturing. This is one of our priority areas as government. We are, for instance, working with the Minister of Trade and Industry, as well as through our entities like the Center for Scientific and Industrial Research, to and also we have been in engagements with sections of industry, for instance, that are able to produce ventilators. So that is work in progress, because our target is to ensure that we move towards producing ventilators, for instance, locally. We will be able to make, through the Minister of Trade and Industry, announcements on that score as we actually move. But it's one of the priorities that we do need to manufacture some of these locally. Now, on the drugs that are being tested, I must say that we are actually ready to start testing now whether those drugs, as I have said, that may be treating malaria or other diseases, are they actually responding positively. We are just waiting approval now from the health regulatory bodies to be able to give us the go-ahead to do that. But I'm very pleased to say that we've moved pretty fast here, so that as soon as we get approval, we are, for instance, going to be able to begin to produce some of the local, or some of the kits locally, so that we are able to start testing even as early as next month. Thank you.
Thank you very much, ministers. Priscilla, are you on? Okay, seems not. Are there any further questions, colleagues? Thank you, Taki.
No, thanks, Ishmael. We have a question from Sophie Mukwana from SABC, and the question is, did the researchers also ask people about the possibility of vaccine trials in South Africa? And another question is from Tebuko Monyo from Radio Riverside. The question is, will the results of the survey be used to influence decision-making of government in as far as continued lockdown strategies are concerned, and what might be the cause of more people believing we are a low-risk nation as far as the infection rates are concerned, and how is government going to mitigate against this complacency and or a misperception?
Thank you very much. Any telephone calls? Nothing. Thank you. Only one telephone call. Yes, please, ma'am. Okay.
Professor, you're through.
Oh,
It's Professor Reddy from the HSRC. I've called in to respond to the question.
okay, proceed, Prof.
So could you outline the questions for me, please?
Prof, the first question relates to the issue of the vaccine, the trials on the vaccine. And secondly, whether government will be able to take the results of the survey into consideration when making determination on the lockdown phases. And that, I think, the Minister and the Deputy Minister will respond to that. But probably you can respond to the first question, which relates to the tests. Which relates to the vaccines, Priscilla?
The question, may I summarize, please? Vaccine.
Yes. Yeah, that's the first question.
No, in this particular survey, there was no question directly asking about vaccines.
Okay. Can you elaborate further on that, Priscilla?
We are planning a third survey as we move ahead with the COVID epidemic, and in that survey, the likelihood that we ask a question about how South Africans feel about a vaccine and their willingness to take a vaccine will definitely be considered.
Okay, thank you very much. The second question, Minister. What was the second one, please?
Yes. I think that what one maybe needs to say in relation to both these questions on perceptions of low risk, it is indeed of concern that the study points to the fact that 1 in 2 people believe that they are low risk. Because it tells us that we've got a lot more work to do on an ongoing basis. But it's good that research is telling that, so that we know as government that we have to intensify education. And for people to understand the point that Deputy Minister Pasha was making, that everyone is almost equally at risk. No one is more at risk. It is indeed possible that elderly people may be more vulnerable once they actually contract the virus. But contracting of the virus in itself, we are all equally. So what this message is sending to us is that government needs to increase education clearly, which was the purpose of this research that is able to inform us what to do, which links to the other question. Will we use these results to guide government insofar as the lockdown, when and how to lift it? Definitely. That is why we pulled in the Human Sciences Research Council, because sometimes the disease is as bad as the attitude that people have sometimes, That you might find that with negative attitudes or lack of cooperation in the way people behave may make the situation worse, as opposed to when people cooperate. And also the beliefs that people may have about the virus also are important considerations in what is to be done. Indeed, this information is very useful. In fact, this set of information, we are relating it closely to the set of information that the Minister of Health and Professor Slim Karim were talking about in terms of what is the likelihood of the virus going forward. Professor Karim did indicate we are still heading for a more steep rise, more infections going forward. But if then we combine that with this information from the social science survey, we are able then to say, if you take that information together, it's very clear that we have to intensify education. But more than anything else also, it means we have to intensify more than just education, but also to ensure that people do actually respect the lockdown. Even if there is an intention in most of the country maybe to move from level 5 to level 4, but that is going to be very important that those restrictions that are still there are enforced. And of course, enforcement will be done by the law enforcement authorities, but the bigger part of enforcement is actually for our communities and our people as individuals. Actually respect distance, maintaining hygiene, and so on. We will definitely take into this. Maybe the last point that we need to say is that one of the things that we've learned from this study is that it is important that health measures, as they start to be used to deal with a pandemic like this, we should also at the same time be pulling in social scientists and their research to be part of the effort right from the word go, so that we are actually having a complete understanding of the nature of the disease and then the manner in which the disease is likely to involve. So this is very helpful work to us, even if it might be saying things we worried about, we may not like, but it's better to know about them so that we are able to act accordingly as government.
Thank you very much, colleagues. Just the last set of questions, if there are any, and then we'll give to the DM as well as the DG if there's any further inputs to be made. Takalani?
No, thanks, Ishmael. We have a question from Stefan Grootz from Newsroom Africa. He said another survey released today suggested there was a significant group of South Africans who would not take a vaccine should one become available for COVID-19. Did this survey find a similar sentiment? And another question is coming from Maya Malan from Bekisisa Center for Health Journalism. How do the survey results of a high-risk knowledge of prevention methods but low risk of risk perception of contracting the virus compare with South Africans' knowledge and risk perceptions of other infectious diseases such as HIV and TB? Is it similar or different?
Thank you, Takalani. DG? Can I start with you? Priscilla, are you still with us? Hello?
Yes,
Priscilla?
I'm still with you, and,
Yes.
and thank you for those questions.
Okay.
I think I'm happy to engage with those journalists offline to give them a detailed response.
Okay. Is there no response that as brief as possible that you can give for now? Then I will later share your details and Anusha's details so that they can engage further with yourselves.
In particular, even in isiZulu and the other health personnel around educating people. Hence, the knowledge was very, very high.
Okay. If it's possible, members of the media and the ones that ask the questions, Takalani, we will link them with Prof. Reddy so that she can engage with them further in answering those questions. If you can have the other questions, please.
The other questions that we have is from Vikas Berger from Network 24. That according to the survey, people are clearly suffering. Some can't even buy food. Will these findings convince government to reconsider the regulations under each of the lockdown phases?
Okay, thank you. Is that the last one? Thank you very much. DM, can I start with you as we wrap up, then Minister will come. Thank you.
Yeah, thanks. Let me just make some remarks on the previous question. The Minister Nzimande has already dealt with, but just to add up to say, while we're disheartened by the low risk perception, but we're also quite heartened by, we're encouraged by the level of awareness. I believe that it's a very good foundation on which then we should build on further understanding, including the level of acceptance of the risk. So through our communication strategies, we need to look at if they are particular, working with the Human Science Research Council, we will have to look at even if it's possible to disaggregate to see whether by age group, whether by level of education, by any other disaggregation, we can be able to look at if there are particular groups which may be more into this issue of low risk, so that we can package our messages also, especially as we expect level 4 and hopefully lower levels where more activity will start, economic and also educational activity. We will then have to take this into account in terms of packaging messages, which might be dedicated at particular groups within our country. The question of that there's a survey which shows that many people would not take up the vaccine even when it's available. I think it's also linked to the low risk perception issue, that even though a lot of people are aware because of the information, they still feel that they are not at risk and therefore they would not. So dealing with it, I think once we can target the messages and awareness in terms of this high level of risk, I think this attitude will change once people feel that indeed it's not something for somebody, but it's also a risk for myself. Whether this actually compares with other attitudes toward other diseases and epidemics, I think actually it's true. If we were to look at where we come from with the HIV/AIDS, if you were to go 20 years ago, after a lot of public education, there were times when a lot of people understood that there is a threat of HIV and AIDS, but that it was for other people. But over time, with various methods of communication and experience, people, unfortunately, sometimes human experience, it's much more powerful than media education. As more people came to know relatives, friends who died from AIDS-related diseases, the attitude has been changing. So, and one just hopes that we don't have to reach that stage with COVID before attitude can change. But it's correct. I think the person who raised the question, it is indeed not unique. We have seen the trend, but we don't have, what we must help the population to avoid is to become more aware of the risk only when it's hit at home. That's what even if we need to make them aware of how the low level of infection and death in other countries have suddenly rapidly rose up. That kind of exposure to such information may probably help. I'm sure Minister may comment on the issue of the economic situation and the access to food. But what before I leave, there's an aspect which came in the report of access to chronic medication. That one we're very worried about, and we will be following up with the researchers, just so that we can check, in various areas, especially highly disadvantaged communities, to see how we can actually mitigate against, because it's a very dangerous situation if in the process of trying to get to assist our communities to avoid a particular pandemic, they then get exposed to a situation where the illnesses which they are already known to be diagnosed of, they can't get the treatment. Then it's going to be a very problematic one, and we will be making a follow-up to correct it. Thank you.
Thank you. Thank you very much, DM. The issue of access to food is a matter that has come out clearly. For instance, that in the survey, 25% of the people said had no food. And in informal settlement, it was as high as 55%. It's interesting that though this study was done before the president's announcements, but the president's announcements were absolutely spot on, even before this information came in this manner, in the sense that the relief, the stimulus package, as well as the relief package announced by the president, was precisely aimed at addressing this issue of food security and also access to food by poor people. It is a matter that government, by the way, continues to discuss. That is why this matter of treating COVID-19 can't be separated from the issue of economic growth and development, so that we are able to have a growing and developing economy that is able to provide jobs and means of livelihood for our people. Government has also been concerned that much as there's lots that is being done, for instance, amongst other things, in providing food parcels to communities, but we are concerned that there's lots of complaints that's coming across about corruption in the distribution of food parcels and so on. And it's something that as government we are looking at very closely, with the possibility also of looking at alternatives to distribution of food parcels, with possibility of moving into vouchers, so that we are able to minimize the corruption that sometimes accompanies the distribution of food in this way. Now, the last set of issues that are raised is that precisely the shift that the president has announced from level 5 to level 4 in terms of the state of awareness and acting, it's partly to actually try and ease the situation a bit, allowing certain economic activities to start. But that must be done, as the president was saying, in such a way that we don't at the same time expose our people to more risk. That is the challenge that we face. It's not an easy challenge. It's very complex. It's very difficult. That is why we need maximum cooperation from our people. That is why we do surveys like this, so that we precisely understand where our people's thinking are, what is their attitude in relation to what is being done. For instance, we are very pleased to hear that overwhelmingly more than 75% of the people have not had negative experience with the security forces. Even the 14% that they feel they've been treated badly, it's important that we know, so that we are able to deal with that, because the aim of the security forces is not to harass people or to treat people badly, but to work with people to ensure that they actually respect the regulations and other things that they need to do. So managing the two things, allowing some economic activity for purposes of survival, but at the same time protecting our people from infection, It's a very delicate balance which requires that in a max. That's why as government we are doing as much as possible to engage and consult with as many stakeholders as possible, whilst at the same time being able to act decisively where we actually need to act. I think that just about covers all the issues that were raised. And once more, let me just thank the HSRC for the good work that they have done. And of course, they are continuing with the survey. We have asked them, for instance, now to focus on particular categories. We've asked them to focus on youth in particular, and in addition also we've asked them to focus on students, as we are moving now to actually dealing with what are we supposed to do in the education sphere, which has got about, if you both schools and universities and colleges, you're talking of just about 15 million, which is huge numbers that can pose a serious threat in terms of more infections if we don't handle that situation correctly. That is why we are moving to understand that situation better as part of dealing with the virus. So we wish to thank them very much. And also let me thank you, Deputy Minister Pahla and our DG Mjwaka, for having been part of this as a very important dimension and component in fighting COVID-19. We say to our people, please cooperate, please keep safe. Thank you.
Thank you very much, Minister. Just to share with colleagues as we are about to close, that please follow us on this discussion on the websites of the Department of Science and Innovation. The presentations and the social media pages will share with yourselves information regarding this outcome, the outcome of this survey. You can as well check us on the Human Science Research Council website, and you'll get all that necessary information of the survey. For the media, members of the media who still wants to ask more questions, please call the following number, 082-389-3587, and ask to speak to Manusha Pillay, who will then link you to various researchers of the survey. Lastly, just to move from the premise of the announcement by Minister, tomorrow, 2 o'clock, we will be announcing measures to be introduced by both the Department of Higher Education and Basic Education as we traverse various phases of this epidemic. So 2 o'clock, the media briefing will take place here. And as members of the media, you know the links are the very same ones that you got us today. So let's join each other again tomorrow. Thank you very much.